lags behind many other high-income countries. This report from Kit Bradshaw.
Party leaders touring hospitals. It's become a mainstay of any general election campaign.
We've now got evidence that under Boris Johnson, the NHS is on the table and will be up for sale.
There will be 50,000 more nurses as a result of the investments that we're making. If we weren't doing this, we would have 50,000 fewer nurses.
But do they see what's really going on? A report out today from the Royal College of Nursing says staff are stretched to breaking point over workloads. It says 6 out of 10 feel they can't provide the level of care they want to patients. Nurse leaders say the number of jobs that currently need fill-in is at crisis level. At the moment, there are almost 44,000 nurse vacancies across the NHS. That's 12% of the nursing workforce. A separate study by the Health Foundation suggests this could hit 100,000 in a decade. And while the overall NHS workforce recently saw a big rise, this, they say, disguises a shift in the makeup of staff. In 2018-19, the number of full-time equivalent nurses grew by just 1.5%. But in the same period, the equivalent number of support staff went up by 2.6%.
The issues that we're looking at here actually have existed for a long time, and it's partly a failure to actually plan the workforce sensibly rather than relying on big pledges which then turn out not to come true.
Another study published in the British Medical Journal is warning it's not just staffing but overall spending on healthcare, where the UK is lagging behind other high-income countries. Less was spent per person here than in 9 other nations, including Australia, France, Germany and the US. Polls suggest the NHS is second only to Brexit as the most important issue for the public at this election. The message from medical groups is that whoever is in government, action needs to be taken to safeguard its future. Kit Bradshaw, Sky News.
Well, here with us now with more details is Laura Duffel. She's a frontline nurse at a London hospital and spokesperson for the Royal College of Nursing. Hello to you. Thank you so much for joining us on the programme this morning. The NHS relying on less qualified staff in order to plug the workforce. Oh my goodness, does that mean that lives are at risk?
No, I think that things are being maintained safely at this stage. I think that nurses and healthcare assistants are working their absolute best to ensure patient safety, but it doesn't change the fact that healthcare assistants haven't been through the level of training that nurses have. And it's actually, I think, putting more strain on nurses to a certain extent because they're delegating tasks to healthcare assistants that normally wouldn't have been done by that level of staffing.
So it's not costing lives at the moment, but I'm guessing if the situation continues that it could.
I think that the situation is that nurses need to have more investment. We need to be able to train people up to the level that they need to be in order to care for patients safely. So whether that's a healthcare assistant, whether that's a qualified nurse, it's all about investment in the nursing staff.
Okay, the survey that we've been reporting on there, pretty bleak picture. Just looking at the percentages, 60% of nurses say they can't deliver the care that they want to patients. What's stopping them?
I think that it's just lack of nurses. We are regularly understaffed on the wards. The patients are actually sicker than they were before with the improvements in medicine. And it does mean that nurses are having to learn more skills that they wouldn't have needed to know before. And it means that they are then in a position where they're providing a higher level care, probably that takes a longer period of time, and they're not able to then spend that time sitting next to patients, helping them with their food, helping them turn when they can't turn themselves, helping them bath when they can't bath themselves. It's all about giving those essential treatments to get patients better, to get them home.
More than a third, according to the survey, are actively looking for a new job. Given that it takes 4 years, I believe, to train a nurse. This is not a problem that can be solved overnight, is it?
No, I'd really like to know where the 50,000 nurses are coming from.
That's a government figure, isn't it?
Yeah, that's what we've been told we will be receiving, and I think it's come from all different sides of the political parties. And I think that I speak for a lot of my colleagues. You know, when we have conversations at work around if there are 50,000 nurses out there, why do we not see them already? It's not an overnight fix, and we need investment in our education. We need investment in our resources, and you know, actually. Retention of nurses. It's not just about kind of plucking a figure out of the air and saying, you know, we can fix this.
So what does the Royal College of Nursing think about that figure of 50,000?
I think that it's a figure that I think that it's just been plucked out of thin air, if I'm honest. I don't really understand where they've got that figure from. I know that there's quotes of the 43,000 nurse deficit, which has come from well-known sources that have done the research behind it. So I think that the 50,000 has just they've just tried to go over the top of the fact that we've got that deficit in nurses.
So it's a lie.